Here are 10 hidden dangers in California's 2026 laws that could put seniors at risk. Did you know that over 1.2 million seniors in California could lose access to critical healthcare or housing support in the next year alone? That is not a prediction. It is a real possibility based on the latest policy changes set to roll out in 2026. These new laws, quietly passed or restructured, may reshape how older Californians live, get care, and even access their own money. And yet, most people have not even heard about them. Some of these changes sound harmless on paper. Budget adjustments, zoning updates, new digital requirements. But behind the legal jargon lies serious risks that could leave seniors struggling with fewer services, less protection, and more confusion. What happens when someone loses transportation to a medical appointment? Or when vital benefits suddenly go digital, leaving non-tech-savvy elders out in the cold for months? In this discussion, we will uncover 10 hidden dangers in California's 2026 laws that could quietly put seniors at risk and what you can do to protect yourself or your loved ones. You will not believe how far-reaching some of these changes really are. Danger 1: Reduction in in-home care funding. Imagine being 78 years old, living alone, and relying on a caregiver who visits daily to help you with meals, medication, and basic tasks. Now imagine that caregiver stops showing up, not because they do not want to, but because the funding that supported their job has just been cut. That is the harsh reality thousands of California seniors may face in 2026. One of the new budget realignments proposes a significant reduction in funding for in-home support services, a lifeline for many low-income seniors. Lawmakers claim it is a necessary move to balance state expenditures, but the consequences could be devastating. Without this support, many elderly individuals may be forced into institutional care, stripping them of their independence and placing more pressure on already overwhelmed nursing facilities. The bigger problem is that not everyone qualifies for full-time nursing care, and many do not want it. Seniors thrive when they can stay in their own homes, emotionally, mentally, and even physically. Research shows that aging in place can reduce hospitalizations, lower anxiety, and improve quality of life. But with fewer caregivers available, this option may be slipping away. So what can you do? Start by exploring local programs. Some counties and nonprofits offer supplemental caregiving services that are not tied to the state's IHSS program. Also, check in with your loved ones now. Do not wait for the funding cuts to take effect. Seniors need advocates, and those conversations could make all the difference. Because losing in-home care is not just about missed meals or medications. It is about losing dignity, freedom, and the right to age on your own terms. Danger 2: Stricter eligibility for Medi-Cal. What happens when you are just a few dollars over the income limit and suddenly lose access to your healthcare? That is the frightening possibility facing thousands of California seniors in 2026. As new Medi-Cal eligibility rules tighten, access to essential care becomes more restricted. Medi-Cal, California's version of Medicaid, is a lifesaver for low-income seniors, covering everything from doctor visits and hospital stays to home care and prescription drugs. But starting in 2026, the state plans to implement stricter income and asset reviews. Seniors who once qualified may now be required to spend down their savings, sell off assets, or reapply under more complex conditions just to keep the benefits they already rely on. The shift aims to close loopholes and reduce fraud, but the effect could be devastating. Many elderly residents live on fixed incomes that barely exceed the cutoff point. And with inflation and rising living costs, they may find themselves disqualified despite having no real financial security. And if they lose coverage, they could be forced to delay or skip medical care, leading to more serious and more expensive health issues down the line. So what can be done? Now is the time to review your financial situation or that of your aging relatives. Consulting with a Medi-Cal planning specialist or elder law attorney could help protect essential assets and ensure continued access to benefits. There are legal, ethical ways to structure finances so that you are not penalized for simply having a modest nest egg. Because healthcare is not a luxury, it is a necessity. And no one should have to choose between paying rent and seeing a doctor, especially in their later years. Danger 3, Pharmacy deregulation and access issues. What if your closest pharmacy shut down overnight and no one was required to replace it? That is not just a bad dream. It is a real possibility under California's new 2026 deregulation policy aimed at streamlining the pharmacy industry. Under the new law, pharmacies in rural or underserved urban areas will no longer be required to provide a community impact assessment before closing. While this move is intended to reduce red tape for businesses, it could have serious consequences for seniors who rely on nearby pharmacies for daily medications, consultations, and emergency refills. Seniors with limited mobility or no access to transportation could find themselves miles away from the nearest pharmacy, turning something as simple as picking up blood pressure pills into a logistical nightmare. And it is not just about convenience, it is about health. Studies show that even minor disruptions in access to medications can lead to increased hospitalizations and a higher risk of chronic condition flare-ups. For seniors managing diabetes, heart disease, or other long-term illnesses, missing just one refill can trigger a health crisis. What can you do before this change hits? First, check whether your pharmacy is part of a larger chain or a local independent store. The latter are more at risk of closure. Second, look into mail-order pharmacy options now before demand skyrockets. Many Medicare Part D plans and Medi-Cal already offer home delivery services, which could become a vital lifeline. Because for seniors, medication is not just a routine, it is survival. And when access is cut off, it is not just a business decision, it is a health emergency waiting to happen. Danger 4, Housing policy shifts affecting seniors. Imagine being forced out of your home because it is no longer efficient for the city's new housing plan. That is the reality some California seniors may face in 2026, thanks to zoning law changes that prioritize high-density housing over age-friendly living spaces. The state's push to address the housing crisis has led to new legislation encouraging the construction of multi-unit apartment complexes and high-rise developments, especially in urban and suburban areas. While the goal is to increase housing supply, the side effect is that senior-accessible single-story homes are being pushed out of the equation. These newer buildings often lack essential features like elevators, grab bars, ramps, or even quiet environments that older adults need for safe and comfortable living. For many seniors, especially those with mobility issues or sensory sensitivities, these new spaces are simply not livable. And if their current homes are marked for redevelopment, they may be left scrambling for alternatives in a market that offers fewer and more expensive options. So what is the solution? Now is the time to get proactive. Seniors and their families should start having conversations about future housing plans. Are there communities nearby with senior-friendly zoning? Are there housing cooperatives, aging-in-place villages, or ADU options that can offer long-term stability? Equally important, get involved in local city planning meetings or housing forums. These laws often pass quietly, but community voices can make a difference, especially when advocating for age-inclusive development. Because housing is not just a roof over your head. For seniors, it is about safety, accessibility, and being able to live with dignity and independence in the place they call home. Danger 5, mandatory digital access for benefits. What if you could not access your healthcare, retirement benefits, or housing support just because you did not know how to use a smartphone? That is exactly what could happen to thousands of California seniors in 2026 as the state rolls out mandatory digital systems for nearly all public services. The new policy is part of California's effort to modernize and digitize government programs. A move that may work well for younger generations, but could seriously disadvantage older adults, especially those who did not grow up using technology. From applying for Medi-Cal to renewing housing vouchers or even scheduling transportation assistance, seniors may now be expected to navigate websites, log into portals, and submit documents, all without in-person help. The issue is not just inconvenience, it is accessibility. According to recent studies, over 40% of seniors over 75 do not regularly use the internet. And many have vision impairments, memory issues, or arthritis, making digital navigation especially difficult. This digital divide could leave many vulnerable to missed deadlines, lapsed benefits, or even fraud as they struggle to manage complex systems they were never trained to use. So what can be done? First, check if your county offers digital literacy programs for seniors. Many libraries and community centers provide free classes. Also, look into appointing a trusted family member or legal representative to help with online tasks when needed. It is also smart to document login information and create simple step-by-step guides for recurring online tasks. Because no one should lose their benefits just because they do not own a laptop or smartphone. In this digital age, access to essential services should not come with a tech barrier, especially not for those who built the very society we live in. Danger 6. Estate law changes could affect inheritance planning. What if your children had to sell your home just to pay unexpected taxes, all because of a new estate law you did not know about? In 2026, California is introducing changes to estate and inheritance regulations that could have serious financial consequences for seniors and their families. One major shift involves the elimination or restructuring of key tax exemptions that previously protected family homes during the inheritance process. In simpler terms, if a senior passes away and leaves their home to their children, those heirs could now face hefty property tax increases or capital gains taxes, especially if the property value has appreciated over the years. What used to be a smooth, tax-friendly transition could now turn into a costly and complicated ordeal. This is particularly concerning for seniors who worked hard to leave behind a modest legacy. For many, their home is their most valuable asset, and they want it to stay in the family and not be sold off to cover surprise fees. Unfortunately, without updated estate planning that reflects these 2026 law changes, many families could end up losing part or all of their inheritance. What can you do about it? Do not wait. Consult with an estate planning attorney or financial advisor who understands California's new laws. They can help you set up living trusts, transfer on death deeds, or other tools that may offer protection under the new rules. Also, review your will and beneficiary designations to ensure everything is up to date. Because inheritance is not just about money, it is about legacy, stability, and ensuring that your loved ones are not left with legal headaches and unexpected bills during an already emotional time. Danger 7. Mental health services realignment. What happens when a senior battling depression or early-stage dementia loses access to specialized mental health care simply because the funding was shifted elsewhere? That is exactly the risk California faces in 2026 as the state moves forward with a realignment of mental health funding that may unintentionally leave older adults behind. The upcoming changes are part of a broader initiative to address the growing mental health crisis across all age groups. While the goal is admirable, the reality is that funds will be redirected from senior-specific programs to more generalized services that may not meet the unique needs of aging populations. This means that geriatric counseling, dementia support groups, and home visit therapists could be scaled back or eliminated entirely. And let's be clear, seniors are not exempt from mental health struggles. In fact, research shows that 1 in 5 older adults experiences some form of mental health issues such as anxiety, depression, or cognitive decline. These are not just emotional concerns. Untreated mental health issues can worsen physical health, increase fall risk, and even shorten lifespan. Losing access to specialized care could have dangerous ripple effects, especially for isolated or low-income seniors. So what can you do to prepare? Start by identifying local nonprofits or private practices that offer mental health support tailored to seniors. Many organizations offer sliding-scale counseling or virtual support groups. Also encourage loved ones to get involved in community activities, which are proven to boost mood and cognitive health. Because mental health is not a luxury, it is a cornerstone of well-being. And in a time when policies are shifting, we must fight to ensure that seniors' emotional and cognitive needs are not forgotten. Danger 8. Transportation program cuts. What if you could not get to a doctor's appointment, pick up groceries, or attend a social event simply because your local senior shuttle service was discontinued? That is the looming reality for many California seniors in 2026 as the state prepares to cut funding for senior transportation programs, particularly in smaller towns and rural counties. These cuts are part of a cost-saving measure targeting services labeled as underutilized. But here is the catch. Many seniors depend heavily on these programs, even if they are not always counted in the data. Whether it is a wheelchair-accessible van or a dial-a-ride shuttle, these services provide a critical lifeline for older adults who can no longer drive and live far from public transportation. Without them, seniors face increased isolation, missed medical appointments, and food insecurity. It is not just about convenience. It is about survival and mental health. Studies have shown that lack of mobility is directly linked to higher rates of depression and hospital visits in the elderly. When transportation disappears, so does their ability to participate in the world around them. So what can be done before these cuts take full effect? Start by checking if your community has volunteer driver programs, church-based transportation, or senior rideshare initiatives. Many non-governmental groups are stepping in to fill the gap. You can also contact local representatives and advocate for keeping essential transit services funded, especially if they serve vulnerable populations. Because transportation is more than just getting from point A to point B. It is the key to independence, dignity, and staying connected to the world. And no senior should be stranded simply because the state decided their ride was not necessary enough. Danger 9: Legal aid funding reductions. What happens when an elderly person is being scammed, evicted, or mistreated and suddenly has no legal support to fight back? That frightening scenario may become far more common in 2026 as California plans to reduce funding for free legal aid programs that primarily assist low-income seniors. Legal aid clinics are often the first and only line of defense for elderly individuals facing complex issues like elder abuse, wrongful eviction, healthcare disputes, or benefits denial. These programs provide free attorneys, legal advice, and representation to those who cannot afford to hire private lawyers. But with budget cuts on the horizon, many of these services will be downsized or shut down entirely, especially in underfunded counties. The timing could not be worse. As scams targeting the elderly continue to rise, from fake Medicare calls to predatory housing schemes, seniors need legal protection more than ever. Without access to legal aid, many will be left confused, vulnerable, and unable to defend their rights in court or even understand what is happening to them. So what can you do? Start by identifying local nonprofits or legal hotlines that still offer senior-focused services. Some organizations provide remote consultations or community legal workshops. You can also encourage seniors to keep essential documents organized and assign a trusted power of attorney to step in if needed. Because knowing your rights is one thing, but having someone to help you fight for them is another. And in a time when the legal system is becoming more complex and less accessible, our seniors should not be left to navigate it alone. Danger 10: Emergency Services Policy Revisions. What if calling 911 did not guarantee a fast response just because you are a senior with a non-life-threatening issue? That terrifying possibility could become a reality in 2026 as California moves to revise its emergency services protocols, aiming to streamline response times by categorizing and deprioritizing certain types of calls. While the intention is to improve efficiency for first responders, these changes may unintentionally delay help for elderly individuals, especially in cases that do not immediately appear life-threatening, like a fall, dizziness, or unusual confusion. But for a senior, even a seemingly minor incident can escalate quickly. A delay of 15 to 30 minutes could mean the difference between full recovery and long-term disability, or worse. Emergency dispatch centers may also begin using AI-assisted triage systems, which, while innovative, might not accurately interpret the nuances of senior health conditions, especially if the caller is unable to fully explain their symptoms. That means a confused or frightened senior could be mistakenly placed in a lower priority category and left waiting far too long. So what can you do to stay safe? Consider investing in a medical alert device with GPS and fall detection. Many of these systems connect directly to emergency responders and can bypass crowded 911 lines. Make sure seniors living alone have a clear emergency plan and that their medical information is easily accessible. Because in a real emergency, every second counts. And no one, especially not our elders, should be told to wait their turn when their life may be hanging in the balance. Conclusion: awareness and action are essential. These 10 hidden dangers in California's 2026 laws reveal a troubling pattern. Well-intentioned policies designed to save money or modernize systems could inadvertently harm the very people who need protection most. From healthcare and housing to legal rights and emergency response, seniors face mounting challenges that many are completely unaware of. The good news is that awareness is the first step toward protection. By understanding these changes now, you can take proactive measures to safeguard yourself or your loved ones. Whether it is consulting with specialists, exploring alternative resources, or advocating for policy changes at the local level, every action counts. Our seniors deserve dignity, security, and the support they have earned through decades of contribution to society. Let us make sure they receive it.